I've entitled my talk today, Preventative and Protective Measures to Mitigate Impact on Children and Families. And the reason I've entitled it Children and Families is because you cannot separate the child from the family. And currently, the situation that we are seeing in India and in other places around the world where there is this second wave, happening, and all the talk of now young people and children becoming affected. A lot of this is due to the fact that we have actually, been able to create vaccines against this virus, which is, incredible, and something that, I think should be highlighted as a great deal of hope, because, just 6 months ago, there was, no definite expectation that, we would actually be successful in achieving this. And so one of the things that's driving the fact that we're seeing now much more younger people getting infected is because obviously the older populations are being prioritized and they are getting vaccinated first. But of course, in India, currently the situation of the resurgence that we're seeing is pretty much due to two factors, and that is complacency and also the rise of these COVID variants. So I like Vivekji's analogy about in a storm, which is currently what India is facing. Don't try and calm the storm, try and calm yourself. Now, I agree that staying calm is paramount. And, funnily enough, when I was asked to do this presentation, I saw this beautiful rainbow in my backyard. And I managed to take a video of it, and I actually posted it on Twitter. In the current scenario where there is so much chaos going on around us, it is very easy to just remain panicked. But it is very important that we all try and focus our mind, take it away from the outer chaos, and move that energy and try and create and focus on inner strength, empowering ourselves with knowledge and understanding how we can continue to live. Because basically, it is not the end of the world. Pandemics have happened before. They probably will happen again. This situation, this pandemic is a marathon. It's not a short-term sprint. Now, using this rainbow concept, which I hope that you will take, what I was trying to convey is that, the children of India, we need to protect them. We can look at under the rainbow as being the protective bubble that we've got to keep children under. In order to get to the end of the pandemic, which is, that elusive pot of gold at the end of the pandemic, we don't know when it's going to be, but we have to protect our children and do everything in our power to protect the children. Now, in order to protect the children, the rays of the rainbow represent the layers of protection we have to apply. Now, in the UK, they came up with this, these words: hands, face, space, and replace. Now, when they talk about hands, they're talking about hand washing. When they talk about face, we're talking about wearing the mask. When we talk about space, we're talking about physical distancing while remaining socially connected. And we're talking about replace. We're talking about the importance of ventilation, because as Professor Santosh Kumar brought up, COVID is airborne. And one of the reasons behind this, resurgence with such vengeance is the, aerosolized spread of these highly infectious mutated strains of the virus. So, and overriding all of this prevention is the vaccination. And, and interestingly, I then learned that actually the name of the vaccination drive for India is Indradhanush. And so I thought that this image, would help people understand that, yes, there are many things that we need to do to protect children during this pandemic. So as you can see in this image, in the green, we have pretty much what happened last year during the first wave of the pandemic in India. Initially, there was, a large, rise in the cases. Then we, had a lockdown, and, there was mandating of masks, and, there was a lot of collective measures. And then what happened? We, flattened the curve, and you had a good outcome. And now what we're seeing is, unfortunately, this scenario where basically, due to the complacency and no longer a concerted community effort, the cases have continued to rise, and we are now having collapse of healthcare systems. Now we can get back. India can get back to where it was just by applying those same rules of the behavioural vaccine, which was going to be basically, our only way out of the pandemic anyway, until we actually developed many highly effective vaccines. And you have to understand that WHO would have approved any vaccine that was over 50% effective. We have vaccines, including the mRNA vaccines of the Pfizer and Moderna, which are over 95% effective. So, I mean, that is something that is a great deal of hope that we need to hold on to. But as other speakers mentioned, it's going to take a long time to vaccinate, the vast majority of the world's population. And, the behavioral vaccine of, washing hands, of watching distance, of wearing masks and watching ventilation is here to stay for quite a long time. Why should I change my behavior? Well, the problem, I mean, people think, during this pandemic, there's really nothing that's in my control. But actually, there is one thing that's always in your control, and that is your behavior. Now, with the more transmissible strains, and, clearly they are more transmissible, we need to keep on following the same rules. But rather than just following the same rules, we have to actually improve what we were doing before. So when I'm talking about that, we have to improve the weapons we already had. So, our mask, which is still our number one defense in, fighting, this pandemic. You've seen countries like France and Germany, in response to the more infectious strains, have mandated premium masks because, they saw that that was an important way to contain the infection. And, all these precautions in terms of, ventilation measures is also extremely important. In order to explain to everybody, what are the three culprits basically responsible in this infection, there are only three. And one is the virus, one is the environment which we expose ourselves to, and the third is the host or the person getting infected, as in me. So I just want to talk about each of these and what we have in control, because this is very important in us understanding how to control the risk to us and navigate the pandemic safely. So, in order to explain the virus, I'm just going to demonstrate using this, ball, which looks very much like the COVID virus particle. So basically, your virus is tiny. You can have up to 10 million virus particles in one drop of seawater. So they're extremely small. And basically, your virus has a protein shell, and you have these little, spike proteins on the surface, and it has a fatty envelope. And on the inside, you have a piece of genetic material called RNA, and that is what the virus uses to replicate itself. Now, the reason we need to wash our hands for 20 seconds with soap and water is because by doing so, we destroy that fatty envelope, and in that way we destroy the virus and it can't infect us. Now, the virus alone cannot actually do anything to us because it can only replicate when we allow it access into our cells. And usually the portal of entry is through our mouth, our nose, and our eyes. And so what happens is when you allow this virus to enter your body, these little spike proteins attach to receptors called ACE2 receptors, which line the cells up of your upper respiratory tract and are also present in various different parts of your body. And one of the reasons why children don't, were relatively protected is they have less ACE2 receptors than adults do. Now, with the more transmissible strains, what's happening is these spike proteins are sticking a little bit better to those receptors, and people are having, higher viral loads, which means that the virus is transmitting more. I mean, this is basically the thought behind it. Now, these spike proteins, it's very important to understand that all the vaccinations are basically designed to reproduce this little spike protein and allow our body to recognize what this spike protein looks like, so that when we actually get exposed to the virus, our body can mount an immune response and fight off this virus. So if you want to understand, the little spike protein of the virus is like the license plate of the virus. And when you get a COVID vaccine, you are getting a small piece of genetic material. It doesn't contain any DNA. It cannot affect your genetic makeup. It is safe. It is just showing your body, this is what this spike protein looks like. This is what this L plate looks like. This is what you have to look out for. And then that little injection that you got disappears, and the body destroys it, and you are left with the memory of this license plate. Now, in terms of the mutations, perhaps what you can imagine is, with the mutation, part of the the L might be missing, but by and large, vaccines are the best way and the only way to end this pandemic, when the vast majority of the world's population, including children, get vaccinated. One of the great studies that just came out and it's great news that in Israel, that today was the first day they had no deaths, after a year, after their very successful, vaccination drive. And one of the effects they've noticed, because children over 16 are getting vaccinated in Israel, is that by the adults and people over 16 getting vaccinated, that the rate of infections of children are reducing significantly. So going back to the rainbow picture, vaccination of family members, and particularly now when India is about to open up their vaccination to all adults over 18, is crucial to get vaccinated as soon as possible. So we know it enters through the upper respiratory tract, and it can virtually go to any part of the body. I just wanted to explain again transmission. When the COVID started, basically the reproductive rate was thought to be 2 to 3. Okay, so basically you're looking that one person can infect 2 to 3 other people. All right, now with the more infectious strains, the nature of COVID, and this is why the COVID spread is exponential, because basically you get one person who infects another 2 or 3, those another 2 or 3 infect another 2 or 3, and so on and so forth, until you have this exponential spread. Now, and that's why you're seeing this, rocket-like curve, happening in India at the moment, because the other nature of COVID-19 is that it tends to spread in clusters. So, weddings, functions, enclosed spaces where people are shouting and singing, and that is the nature of the spread. So, it is very important that we, stay at home as much as possible and cancel all functions, especially in the current context of, this emergency that India is facing. And, the responsibility lies with each individual, because as you can see, I mean, if one person does the right thing and stays home, so many lives can be saved through this exponential, spread and this graph. So, that's a very, very important thing for people to understand. So in terms of the virus, I mean, 6 months ago, I would have said that in that infection triangle, there wasn't really much that you can do to control the virus. But actually there is. Viruses can't mutate if you don't allow them to replicate. That is a basic fact that everybody has to understand. And so basically it is up to each individual to follow those rules of the behavioral vaccine and to break the chains of transmission. And secondly, we need to keep calm and get vaccinated. So there are two modifiable risk factors of the virus. We can stop it mutating, and we can, stop it having such, terrible toll by getting vaccinated, because, that is the best way that we can protect, ourselves and our families. Now, I just want to clarify this issue about herd immunity, which I think is part of the reason why India is facing, such a big resurgence, is that I think there was a belief in India that, perhaps, we could achieve herd immunity through natural infection. And the current upsurgence has proven that this is a fallacy. The only way in which herd immunity can be achieved is via vaccination of the vast majority of the population. So in this diagram, on the first, you can see that, before vaccination, you have, a few pink sheep that have immunity, and after vaccination, you have a lot more pink sheep, so that basically the infection can't spread. The pandemic will stop when one person infects less than one other person, and until that time, the pandemic will keep increasing. So the impact of mutations on herd immunity means that the more transmissible, the mutation, it means the higher the proportion of the population required to be vaccinated in order to achieve herd immunity. So again, I want to stress that we need to break the chains of transmission so that we stop this virus in its track. We do not allow it to further mutate, and we get vaccinated, if we are eligible, ASAP. Now, the second point I want to talk about is the environment. And the environment is impact. We're talking about, transmission routes of COVID-19. Now, initially, the main emphasis was on, droplet spread. And they're the big, droplets that we expel from our mouth when we, cough or sneeze. And that's why we had the whole, coughing into the elbow, which is still important. And also we had surface transmission. And early on in the pandemic, I made a video explaining how people could, make up disinfectant solutions in spray bottles. And you can see that on my YouTube and understand how to, get rid of any surface spread of the virus. Now, the actual most significant mode of transmission that's coming to light is aerosol spread. And I think this is playing a big role in India, because from all the stories that I'm hearing, is that even relatively healthy people are getting quite devastating effects on their lungs. And as you can see in this diagram, is that the aerosols, and to explain to you, I'm just going to demonstrate using a spray can. This is just a Dettol Blend 20 spray. Aerosols are the fine particles that we emit when we are just even breathing or talking. So they look, you can imagine that it looks like smoke. So there's this sort of fine spray, okay? So what happens is that, these aerosol particles, if we inhale them, they can, obviously bypass our upper respiratory tract and go straight down, into our lungs. In an enclosed room, if a lot of people are talking for a prolonged duration of time, even if they are wearing masks, over time, these aerosols will increase in concentration in the room, and that will depend on the number of people speaking. So that is why there is no safe distance indoors when sharing indoor air with people outside your bubble. You need to minimize the time, and you need to make sure that the air in that room is getting replaced and refreshed by the introduction of fresh outdoor air, and that it's not a air-conditioned space with the air being recycled. So, and again, when we talk about environment, I just wanted to go back to the importance of our bubble. All right. So I've just got this, snow globe to demonstrate that in order to protect, and kids remained quite protected during the first COVID wave because the authorities were telling people that children were vulnerable, as were the elderly, and they were kept home and kept safe. Schools were closed. Now what's happened is kids have gone out, they've gone to school, they've gone to tuition, and they've been exposed. And in some cases, it's the children that are bringing back the infection. Children, thankfully, are not getting severely affected, but, family members are. So we have to go back to making sure that our house is a COVID safe bubble. That means when any adult comes, back into the house, or like particularly for dependent children under the age of, 5, or even you need to educate your older children who are independent that, they need to decontaminate properly, wash and sanitize, wash their hands, remove their soiled mask or any clothing and before they enter the house. Now, in the scenario where somebody in the house is infected with COVID, then you have to think, if I shake this bubble, you'll understand that those COVID aerosolized particles are now inside your house. Okay, so if there is an infected person, it is, even if you suspect that somebody has COVID, because you may not be able to get a test or the test may be unreliable. So if they are symptomatic, you've got to assume they have COVID and they need to self-isolate away from other family members straight away. They need to be in a well-ventilated room with their own washroom, preferably. If they're using the toilet lid needs to be down, where they're flushing, because the plume of the aerosol from the flush can also create more COVID aerosols. And, we need to carefully wash the surfaces. So that's, just to explain to you in terms of the bubble and how it reverses if somebody in the family actually is also having COVID. Now, I just wanted to quickly talk about masking. Now, in terms of children, it's very important that they wear well-fitted masks. Now, not everybody has access to a premium mask, but masking is absolutely key. As you can see in this diagram, an N95 will only work well if it's fitted well. So you need to wear masks properly, and the mask fit and filtration matters. So I just want to demonstrate a quick tip for improving the mask fit for a child. And I have this video on my YouTube as well. You just take the knots, the loops, and you put a knot at the end of the loops on either side. Folding it, obviously knowing that the blue side is the waterproof layer, the colored side. Okay, and this is good for anybody with a small face, and your mask is going to look something like this. Then you need to tuck in the edges. You need to put it on your nose and your mouth, and then you just need to tuck in those folds. And see how this has changed the shape of this simple surgical mask into more of a duck shape, like what an N95 mask has. And it has got rid of these big air leaks that otherwise would be there for children and for adults with smaller faces. And this is essential because, we need to protect, ourselves. And the other thing is eye protection is very important, okay? Because again, it is a portal of entry and we need to try and reduce the viral load. Same holds for children that are old enough to do it. Now, just quickly on ventilation measures, this is a very good chart which basically shows that you need to have, the air needs to be fresh, you can filter it, and it should be flowing. And you can use things like fans at windows to try and direct the air. You should make sure that you're not trying to propel somebody's aerosol towards another. Another very useful thing that Professor Kumar, you were asking about whether it was safe to be outside. It is safe to be outside generally, except that, if you can maintain a physical distance outside, then it's fine. because there is dilution in, in the atmosphere. And so they have these things called CO2 monitors. And there's a very good table which basically, I'll share these resources with you, where you're aiming, where you can measure what the CO2 is, and that can basically tell you how well ventilated that space is. And you're trying to aim for a CO2 reading of less than 800. To reduce risk, you need to have a well-fitted mask, you need to keep your distance, you need to avoid crowded places, and you need to reduce the duration of time where you are in enclosed spaces. But generally speaking, outdoors is okay, so that's very important. Now, in terms of just if you think you have COVID, as I said, I have got that video which I suggest that you watch. Stay home, self-isolated, get medical advice early in the household. Everybody, including if the child can't wear a mask, then the person assigned to looking after the child that's infected should be wearing a mask. Have your home disaster management plan ready. So all the things that I suggest in my COVID home management video, you can make up a little disaster management kit of your own, and keep everything ready and available so that that is something that you can do. My video is available in most of the regional languages of India, and all of the things, there is no pharmaceutical or medical intervention that I suggest. They're all very simple exercises that even a child can follow. But one very important thing, the most important thing for protecting children is back to the basics of making sure that that we are looking after their general health, and that also includes their mental well-being, because that's the most important thing for their immunity. So your healthy lifestyle in terms of eating and sleeping well, in terms of avoiding vitamin D deficiency, in terms of keeping up with your childhood vaccinations are extremely, extremely important. I do think that simple techniques that would be good and make sense is that when anybody returns from the house, just rinsing your mouth with some warm salty water and getting a simple saline spray and spraying it up your nose, and then actually using a physical brush and brushing your tongue is useful, practical things that you can do, because a lot of these receptors are in your upper respiratory tract, and because they are accessible, diluting any viral load will help, and it won't cause harm. And it's something, everybody feels like they want to be doing something, and this is something that you can do which will help. Again, if a child is infected, generally speaking, they are going to make a recovery without requiring any other medications than simply Panadol. But there is no harm in getting the child to do preventive things such as breathing exercises. I have great ones of balloon blowing, blowing bubbles into a cup through a straw, which is great fun for children and is a good way for them to make sure that their lungs are, remaining protected. And of course, you can keep an eye on their oxygen saturations with your pulse oximeter. The other thing I wanted to briefly mention, and it's extremely important, is, this proning. We're talking not just young children, we're talking older children. There is no room for complacency. I, as a parent, if my child was infected, I would do everything in my power to make sure that that mild infection did not become severe. These are simple things. Poses help improve the oxygenation of the lungs. You can put a pillow under the child's chest. You can give them a little iPad which they can look at, and they can sit in these poses comfortably. You can get things like, triangle pillow, and just make it fun for the child, and keep their anxiety levels down. So yeah, just in summary, basically, the behavioural social vaccine for COVID-19 is highly effective, and that is we need to wash our hands, amen, avoid touching our eyes, our nose and our mouth. We need to watch our distance. We need to wear a well-fitted mask that covers our nose and our mouth, and preferably wear eye protection, and we need to watch the ventilation carefully. And basically, we just need to stay calm, carry on with the precautions while we, wait for the entire population, vast majority of the population to get immunized. And as I said, hands, face, space, replace, vaccinate, protect our children, and let's get to the end of this pandemic, as safely as we possibly can.
Thank you very much, Dr. Sandhya.
Yeah.
Thanks a lot. We were just extremely wonderful the presentation, the way you did the practicals over the screen, and that will be much more helpful for all our audience here. And Kajrila sir, just passing out the time.
Sure.
So
Thank you. Thank you. Very practical and very insightful, Dr. Sandhya.